Hello and welcome to this short video guide for patients undergoing total hip replacement surgery at Niagara Health. In this video, we will review how to prepare for your surgery and what to expect during your hospital stay and discharge home. This information is also covered in your pre-op education booklet. Please note that all information presented in this video relates to physiotherapy and occupational therapy protocols. This information is not intended to replace the medical advice of your doctor or healthcare provider. You will receive additional information that is not covered in this video during your pre-op appointment from other disciplines. The hip is a ball and socket joint that allows your leg to move forward, backward, from side to side, and turn in and out. Sometimes the smooth coating over the bones gets rough, dry, and worn away, and the muscles weaken. This can make your hip painful and hard to move. You may need a hip replacement to lessen your pain, improve the function of your hip, and make your hip more stable. Your surgeon will remove the old hip joint and put in a new hip joint. This is called a hip replacement or arthroplasty. Complete the following tasks to ensure you are prepared for surgery. Start an exercise program to get stronger. Arrange your household to keep important items within reach. Create a clear path in your home. Remove all electrical cords, throw rugs, and anything else that may cause you to trip and fall. Install night lights to make it safe to move around at night. Install handrails on inside and outside stairs. Ensure you have a high, firm chair with arms to sit on. Use furniture risers or a firm cushion to raise the chair height if needed. You may want to consider installing grab bars and a handheld shower in your bathroom, but these items are not required. You will also need to obtain certain pieces of equipment, which we will describe next in this video. If you can, practice using this equipment. And finally, please arrange for assistance with shopping, transportation, cleaning, and pet care for approximately 6 weeks. You must rent or purchase the following pieces of equipment prior to your surgery: a two-wheeled walker, a raised toilet seat, or commode, a tub transfer bench if you have a bathtub, and a shower chair if you have a walk-in shower, dressing and bathing aids if you do not have assistance at home, including a long-handled reacher, a long-handled shoehorn, a sock aid, elastic shoelaces, and a long-handled sponge. The following pieces of equipment are not mandatory, but are useful in many situations: a cane if you need to use stairs, and for when you are ready to transition away from using your walker. Please note some vendors are not open on weekends. It is important to obtain all of your equipment prior to coming to hospital. Please bring the following items with you to the hospital: Your New Hip Education booklet, your glasses, dentures, and hearing aids, loose, stretchy clothing. For example, loose underwear, jogging pants, stretchy socks, and a loose top are good options. Lightweight supportive shoes. No backless or poorly fitting slippers are allowed. Your two-wheeled walker, and please ensure it is labeled with your name. Your personal items such as your toothbrush, toothpaste, and grooming items. Your CPAP machine, if you are using your device at home. And please leave your valuables at home. You will go home from the hospital once you meet the criteria for discharge. This will likely be the day after your surgery. Make arrangements ahead of time for someone to pick you up, take you home, and stay with you for a few days. If you live alone and you require more help than your friends and family can provide, consider respite care. Respite stays are offered at some retirement homes. Each retirement home will offer different packages, but generally accommodation, meals, and housekeeping services are included in the cost. You or your family can arrange this prior to surgery. All equipment should go there with you. Alternatively, you could consider hiring private housekeeping, meal delivery, and personal support services. These services would assist you in your home at a cost. After your surgery, you will need to follow these rules to help your muscles heal and keep your new hip in place. Follow these rules for at least 6 weeks after your surgery, or until your doctor tells you to stop. You may hear hip rules called hip precautions. They are the same thing. Rule number 1. Do not bend from the hip or waist past 90 degrees when you are sitting, standing, or lying. Rule number 2. Keep your legs separate. Do not cross your legs at the knees or ankles. Rule number 3. Do not twist your operated leg inwards or outwards from the hip. After your surgery, you will be seen by the therapy team, which consists of a physiotherapist and occupational therapist. The therapy team will review a number of topics prior to your discharge from hospital, including your weight-bearing status. Please note, unless otherwise told, you will be weight-bearing as tolerated. This means that you can put your full weight, or as much as you can tolerate, on your operated leg. Your therapy team will also review the following topics, including the exercises that you will be expected to complete in hospital and at home, how to transfer and walk safely with your walker. This includes getting in and out of bed, chairs, and the car, how to navigate stairs, how to perform your daily activities like toileting, dressing, and bathing with your adaptive aids, and any additional equipment recommendations and energy conservation strategies. The majority of your recovery and rehab will take place at home. The following recommendations are important to support your successful healing. On discharge, ensure you are taking your medications as directed. Follow your hip rules. Use your walker for safe mobility. Use your adaptive aids for bathing and dressing tasks. Change positions frequently and avoid sitting for greater than 45 minutes at a time. This will reduce swelling and stiffness in the hip. Perform the recommended exercises. Keep your dressing bandage clean and dry unless otherwise discussed with your surgeon. No showers, baths, or use of hot tubs, swimming pools, or saunas until discussed with your surgeon. Arrange to have your follow-up appointment 2 to 3 weeks after surgery, or as ordered by your surgeon. If staples were used, they will be removed at the follow-up appointment. Ensure you have a physiotherapy appointment scheduled. This will either be at an outpatient clinic or through Ontario Health at home. If you are receiving physio through Ontario Health at home, the physiotherapist will visit you at your home. Do not drive or return to work until directed by your surgeon. Thank you for taking this time to prepare for your surgery. Please refer to your education booklet titled Your New Hip for more details, and if you have any questions, please let your inpatient therapy team know. Finally, on behalf of the whole Niagara Health team, we wish you a swift and smooth recovery from your surgery, with hopes for your health and well-being in the days ahead.